And we're at the top of the hour. So, Miss Brenda. Dun, 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 dun.
Time to start.
You are to start.
Is everybody ready? Okay, so guys, many of you have been listening to us say this for a few minutes now, so thank you for joining early this. Welcome to the Bridge Club. We are truly, really excited that you're here. We're truly excited to have a fabulous session for you. Catherine and I created the Bridge Club. A couple of you have been asking about this. Created the Bridge Club to really encourage people within the profession to have the opportunity to have real conversations, to connect with each other, to engage with each other, to learn from each other, and hopefully to grow both as a person and as a professional. So that's what this is really all about. We've mentioned a couple times, this is not a webinar. We want you to participate. We want you to listen. We want to see your faces. So get that whole webinar thing out of your head. This is a totally different kind of engagement right here, okay? A couple other things we do here a little bit differently is we do record the session. We do make it available to our All Access members on a regular basis. Tonight, we are fortunate to have a sponsor, Virbac. And Virbac is going to help us make this video available to you. So if you want to watch it again or watch it with a friend, you'll be free to do that. Point number 2, we do want to hear from you. So you can mute if you have any noise going on in the background, or you can unmute and listen in. Feel free to raise your hand and ask questions. Dr. Pike's going to give you a few opportunities to weigh in on some things. Turn on your camera. Most of you done that. Yay. Thank you very much. And critically important to the success of the Bridge Club is to have a beverage in hand so that we can start our session with a toast. So that's the housekeeping. Feel free to ask questions through the chat if you have any for us. Just want to again say we are really fortunate tonight to have Virbac Animal Health sponsoring this session for us. It's a really terrific topic. And we are going to give you a quick little disclaimer here because we're going to be talking about medications. And where medications come, there are rules we have to follow. So just a quick little look here at that. Now, okay, so we are going to get into our discussion. So Dr. Amy Pike is our host tonight, and Dr. Pike is one of only 80 board certified animal behaviorists in the United States, or in the world, excuse me, in the world. Oh my gosh, it's even bigger than we thought. She gained her love and appreciation for dogs during her serving in the military, and she is active duty. So we want to opportunity to thank Dr. Pike right now for her service to our country, and thank you. I appreciate that. Yes. So, ladies and gentlemen, please welcome Dr. Amy Pike, who will give us a toast and get us into our conversation.
Thank you, Brenda. Just to clarify, I was active duty. I'm not any longer. So, but my husband is, so I'll take the thanks anyway. So, all right. So, in case you didn't see, I have my wine glass here, and it says wine because kids. So I'm also a mom, and that's the reason that I drink. So let's toast. Here's to us, the veterinarians and veterinary nurses. We have the hardest job in the medical profession without any of the glamour, because let's be honest, it's hard to be glamorous with your finger up a dog's rectum, covered in anal glands, and very few of us look like that Evan guy on TV. Without the wealth, because whoever said becoming a vet would literally pay off was absolutely hallucinating. And often without the gratitude from our patients, because it's pretty hard to feel loved when our patients are trying to scratch and bite us. So let's lift our glasses, and here's to us. Cheers.
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 All right. So with that said, today I wanted to talk to you about all those ungrateful patients of ours, the ones that want to scratch and bite us and do all of other sorts of things to get away from us, even though we are, you know, with open, loving arms, wanting to love all over them. So I want to show you a quick video of one of those patients. And this is actually a dog named Pongo. And Pongo didn't like going to the veterinarian. In fact, Pongo didn't like going anywhere if it involved riding in a car. So can we cue up Pongo's first video, please, ladies?
Yeah. Oh, sorry, didn't mean to start again. Sorry.
So that's my friend Pongo. It's actually not my friend. It's Teresa DePorter, one of my co-resident mates when we were in our residency together. It was one of her friend's dogs, and the dog had separation anxiety, and so had to come to work with mom every single day. And so back and forth to work every day, the poor mom had to endure the panting, the drooling, the barking, the dog never sat down, etc. So we're gonna get back to Pongo in a bit, but the first thing that I want to ask you guys, and please Share your answers, thoughts, concerns, whatever. Who thinks they know how many dogs and cats actually don't like going to the veterinarian? You can shout it out. You can raise your hand, put it in the chat.
Your mute button is in the upper right-hand corner.
And Danielle has raised her hand.
Yeah, Danielle.
Danielle, share with us.
Uh-oh.
Oh, where are you, Danielle? Are you on mute? Okay. So Shannon has shared 85% through the chat.
That's quite a bit. I would guess that that's my patient load for sure.
Laura's telling us she thinks all of them, and that's actually what I was going to say too, all of them.
Yeah. So this is according to owners. Anybody else have any other guesses?
What was the question?
Oh, repeat the question. How many dogs and cats don't like coming to the vet's office? According to their owners.
All of them.
Yeah.
Putting up owners.
Yeah. I think a lot of them do have stress, but the owners don't necessarily recognize it. So I would say it's probably higher than this survey, but the survey said 1/3 of dogs and 2/3 of cats. And this was the their veterinary healthcare usage study. But this is why we're not seeing cats, guys. This is 2/3 of cats don't want to come see us. The owners are like, I'm just going to keep them at home. They're indoor only. I don't have to worry about, getting shots, that kind of thing. So they're definitely not going to come to us unless it's something urgent, right? Okay, so how many of you know what percentage of patients we lose to behavior, just behavior, every year? Anybody? And this can be behavioral euthanasia, this can be relinquishment or rehoming, or just not coming because of the dog or cat's behavior.
One guess of 50%, another one of 10%, 25%, 38%, 15%.
Oh, ding, ding, ding. Who got the 15%?
Oh.
Marianne.
Woo, Marianne.
No, not Marianne. Sorry, Marianne.
Oh.
Is it Daphne? Danny.
Like Danny did.
Good job. So so it's 15% of our patients are lost annually from general practice for behavior problems. And so I wanted to give a little math because I don't do math in my head very well. So let's estimate that our clinic has about 3,000, can you see that? 3,000 active patient files. So 15% is 450 patients that we lose every year. In 2011, so we know this statistic actually is probably much higher, but in 2011, the average vet visit according to the AVMA cost $505. I will tell you, I'm in the DC area, that's like chump change. It's probably 2 times that for an average vet visit. So just loss to behavior is almost $230,000 a year. So not only does it affect, our patients, ourselves, but it also affects our business too. So we really need to be helping these patients, number one, with any behavioral problems that they're having at home, but also their behavior in the veterinary clinic. So I'm sure the number one question, obviously, that you guys want to know is how do we do that? How do we make our patients less fearful? The first thing that you can do, number one, is become fear-free certified. Is anyone fear-free certified? Yay, see lots of
hands. Yeah, way to go.
Lots of hands. Good job.
Yeah, so that is a really good first step. Fear-free has levels of certification. So there's level 1, level 2, and level 3 right now. Level 1 is the intro course. Level 2 gets way more advanced, and then level 3 is even further advanced. So it's definitely something that you need to keep up with. So a lot of these products that I'm going to talk about tonight, actually, you've probably heard about it, fear-free, but we'll talk about them based on sort of my thoughts about the products. So the first thing is our pheromone products, and I brought props for show and tell. So the first one I wanted to go over was Adaptil, pheromone from mother dogs. So this is basically what mother dogs produce when they're nursing their puppies. It's the intermammary pheromone. It comes in several different formats. It comes as the collar, which the dog wears. It basically warms up with their body heat and emits that synthetic version of that pheromone. It comes as a spray, and it's now called Adaptil Travel because it works really well for car rides like Mr. Pongo. For the vet clinic, my nurse calls this our perfume. We literally put it on every single day. twice a day. In fact, it's my morning perfume and my noontime perfume as well. So lots of different formats that it comes as. You can spray your tables, you can spray the mats that go on the tables. You basically can't get enough of the pheromone. The other thing it comes as is a diffuser, which I did not bring, but it's almost like a little Glade plug-in. You plug it into an electrical outlet and it emits that pheromone. So those are really good for your exam rooms, for plugging in next to dog crates. They only cover about, oh, I see one there. Yep. That's
Yeah, there we go.
I love it.
Show and tell.
I know, I love it. I have little kids, so show and tell is like perfect. So lots of different options and modalities for the adaptyl pheromone. Now I'm going to talk about the analogous pheromone in cats, and that's the Feel Away multi-cat. So this is the maternal appeasing pheromone that mother cats produce when they're nursing their kittens. And the reason that they call it multi-cat is it has been shown to also have an affiliative property. So it works really, really well in inter-cat aggression cases. But I actually wish that they hadn't named it that, because I also like it. So this is actually the diffuser that I have. We have these plugged into our exam rooms at the clinic. And then I recommend these even, like I said, in single cat households. So that's the analogous pheromone for the kitties. And then there's another pheromone. This is called Feel Away Classic now, because it's the original Feel Away, which is the facial pheromone that cats basically deposit in their environment when they're rubbing their whiskers on things or when they're bunting. So this comes as a diffuser. It comes as a spray. It comes as wipes. And I love the wipes. They're little, almost like a little alcohol pad here. So just like one little wipe. And you can give these to cat owners. What I do is I actually tape it to their carrier so that they take it with them and then they have it for that next vet visit. They can wipe out the inside of their carrier. They can wipe out they can actually put the wipe in the car for the way there. One of the clinics that I worked with when I was in my residency program, they started taking a wipe and putting it in an envelope and mailing it to the client if they had enough time to get snail mail there. But they would basically mail it to the client, and that way, anytime they made a appointment, they got the wipe and so with a little note. And they actually saw a significant increase in cat visits because of that. Because the cats weren't meowing, they weren't pooping and peeing in the crate, they weren't doing all of that kind of stressful stuff for the owner, and it was a much better visit. So that is the pheromone products. Does anybody have any questions about the pheromones? Any use of them? Yeah, Marianne?
I do. You said that you spray on the adaptyl during the day, but is there a problem when you go from dogs to cats?
It's not. It's not cross-reactive between the two. So you can actually have an adaptyl diffuser and a Feel Away diffuser plugged into the exact same exam room. You can use the Feel Away spray and the adaptyl spray, no problem. So good question, though. So
you can have both on you, and it's okay.
Yeah, absolutely.
Cool, thank you.
Absolutely. So, and I don't see as many cats in behavior practice as you guys do. I mean, you think you're not seeing as many cats. I'm definitely not seeing as many cats. So I very rarely have to spray the Feel Away, but if you're in general practice, you can definitely do both. So, yep, good question. And in the home, the multi-cat, you want to put the multi-cat where the cats spend the majority of their time resting, basically where they would get that maternal appeasing pheromone the majority of their day and night. And then you want to put the facial pheromone, the Feel Away Classic, at places of co-located territory or any sort of territory for the kitty. So that would be like food, water, litter boxes, climbing towers, that kind of thing. So that's within a home, you can use both of those Feel Away modalities. So any other questions about pheromones before we move on to nutraceuticals?
Amy, there was a nice comment here from Kristen, who said they put the feline spray on their scrub top and the dog on the bottom.
Oh,
so you're hitting, where the cats are and where the dogs are. So that was pretty clever.
That is true. I like that a lot. Good job. Excellent. Anybody else? All right, great. Okay, so let's move on to nutraceuticals. So nutraceuticals, basically something made from, basically a supplement, something made from a nutritional component. So the first one that I want to talk about is Zilkene, and here's my little Zilkene bottle. And what this is alpha-casozepine. So alpha-casozepine is a protein found in cow's milk. And so this basically, if you've ever heard of the saying of drink a warm glass of milk before you go to bed, the reason is alpha-casozepine binds to the benzodiazepine receptors in the brain. So this comes as a capsule. You basically break open the capsule and you sprinkle the powder on the cat or dog's food. This product, so this alpha-casozepine, is also available in a couple diets. So it's available in the Calm Diet by Royal Canin, as well as the CD Multicare Stress Formula. So those are two other options of how to get the alpha-casozepine. Any questions, concerns, thoughts about that?
There was one quick question on the collars, back on the collars. Are you a fan of the feline pheromone collars?
No, and the reason is a couple things. Number one, the companies that make those pheromone collars actually can't prove there's any pheromone in them. Number one. And then number two is that biologically that doesn't make sense. Just because the cat has the pheromone doesn't mean that they're automatically calm. Otherwise, every cat we saw would be totally calm and chill. It's actually the process of depositing that pheromone in the environment and then coming upon it later and to say like, oh, I've been here. It's my comfortable zone and my territory. So good question though. So no, I don't recommend those. Okay, so Zilkene, anybody else any questions?
Hey, Amy, I have a question. So are you finding yourself using Zilkene more as an event specific or as a long-term chronic?
You can do both. So you can do Zilkene every single day, and then you can do Zilkene event-wise. So like, say a dog has issues with grooming, you could give it, the morning of a groom. You can also combine the two. So if you're giving Zilkene on a daily basis, you could also sort of double the dose for an event, whether it be storms or vet visit, something like that. So you kind of can play around with it depending on the patient.
Are you starting a couple days early for vet visits and grooming appointments?
Yeah, ideally that would be great. I would probably about a 7 to 10 day leeway, window of time before the actual visit, but it really
doesn't always happen.
Yeah, exactly. It doesn't always happen, and it really does depend on the patient. I will tell you, like in my household, I have 3 dogs that are all on different various supplements, of course, because I'm a behaviorist. And one takes one situationally, one takes one every single day, plus during storms, and then the other one just takes it every single day with no added doses, basically. So, okay. Yeah, good questions. And then the next supplement that I want to talk about is Angzitane. Angzitane is the product by Virbac. It's an L-theanine supplement. This is a product that's near and dear to my heart because this is actually what I did my residency research on. And we found a significant effect for thunderstorm phobias, giving it twice a day, every single day. So L-theanine is an amino acid in green tea. And so a lot of people drink green tea for its anti-anxiety properties. And the reason is that it increases GABA, which is our inhibitory neurotransmitter. It increases dopamine, which is our pleasure neurotransmitter, and increases serotonin, which is our coping neurotransmitter. So it's kind of a 3-pronged approach for anxiety. It is a chewable tablet, and it is very, very palatable. Teresa DePorter, who provided that Pongo video, calls it kitty crack because even will take this. So they actually, if they will take a hard treat or a hard kibble, they will take Angzitane. So actually want to show you the follow-up video for Pongo because Pongo was given Angzitane twice a day for 2 weeks, sort of experimentally by Teresa, and since it was her friend. And this is Pongo after 2 weeks of Angzitane and nothing else.
Okay, I'm working on it. I'm on it.
Yay. Yay. Love that. He actually lays down. So, I mean, that was a really simple intervention. She did no behavior modification because let's be honest, we can't get our friends to do any BMOD at all. So that was a very, very simple, just give your dog this twice a day as a treat and easy peasy. How simple is that? So that is Exitane. That is, let's see, that's all the nutraceuticals I wanted to talk about. Do you guys have any questions about any supplements? Yeah, Marianne.
There we go. CBD oil?
Yeah. I get that question a lot. So from clients and other vets, I'm sort of, the jury's still sort of out on CBD oil. I have a lot of patients that their owners have tried, and with sort of mixed results. Most of them have been meh. But I also have a very skewed patient population too. I mean, I'm in referral medicine. You guys send me your worst patients. I do have one separation anxiety case that responded beautifully to CBD oil as a situational, so just prior to departures. But at this point, I'm at least not recommending it. And there's a whole nother discussion around CBD oil, about the legality and all that kind of.
Well, and about quality. About
quality.
And knowing which is the better one. Absolutely.
Yeah,
I was just wondering if you had any history with it.
Yeah, absolutely.
And not to put in a plug too quickly, but we're going to be talking about that on the Bridge Club here coming up soon. So just as a little plug.
There you go. Perfect. So, all right. Any other questions about, I think I saw a question about, is it nutraceutical over the counter? And yes, they're all over the counter. Some companies will only sell to veterinarians, like Virbac is really good about only selling to veterinarians. Vetaquinol tries to do that as well. But I will tell you that pretty much everything ends up on Amazon these days. And so most of the owners can find this stuff OTC. Good question.
So a couple that came in too. We have 2 seconds for a couple of quick questions. So we have there's a question from Melissa asking if you like Soliquin.
I don't like Soliquin as much, only because, well, a couple reasons actually. So number one, I think that L-theanine, because of the half-life, should actually be given twice a day. And Soliquin's only labeled for once a day. And L-theanine is very unstable on the shelf. And so the way that Virbac has their L-theanine product package is actually a blister pack. I can pull it open and show you guys. So it's a little blister pack that you actually have to pop, one pill out every day, basically. Whereas Soliquin and Composure and some of the other OTC L-theanine supplements are all in like a bag, and it has a little, Ziploc bag. I will tell you, if your spouses or partners or anybody is anything like mine, he can't close the Ziploc bag to save his life. Like, it would go bad in my household in like 24 hours. So I think that's another reason why I'm not recommending it. And I will tell you, when we didn't have Exitane, because, it was off the market for a while because of the Virbac shutdown and such, and I had to switch to Soliquin, and I just really was not as happy with it in my patient load. All right, so let's talk meds. My nurse is fond of saying drugs are not a 4-letter word. Because I'm a huge proponent for better living through chemistry. I'm only going to show you guys the FDA labeled and approved drugs. We have Reconcile, which is the FDA approved drug, fluoxetine, so it's the dog Prozac. And we have Clomicalm, which is our tricyclic antidepressant. Both of those are FDA labeled for dogs with separation anxiety. So if you're using them for anything else, that's an off-label use. These are what are considered daily medications, meaning they have to be given every single day in order to affect the brain chemistry. So they can't just be given 1 or 2 doses and then the owner says it didn't work, right? That's not how those medications work. Clomicalm, our tricyclic antidepressants, are a little bit faster acting than our SSRIs, but most of them take about 4 weeks to see initial effect. And we always start at low doses and then work our way up to minimize the potential for side effects. The other FDA labeled medication that we have is Cilio. So Cilio is a situational medication. It is dexmedetomidine oral transmucosal gel. So it's a gel that you apply between the cheek and the gums. It's FDA labeled for storm and fireworks, basically noise phobias. It reminds me of horse dewormer. And so you have to dial the little dial down to however many dots, basically, the dose is, and then it only allows you to dispense that amount. And so this can be very, very effective as a situational. You can give it every 2 hours for a max of 5 doses in a 24-hour period. I have used this anecdotally off-label for vet visits as well. So it works as a great pre-veterinary pharmaceutical. You give a dose 2.5 hours before the visit and then another dose 30 minutes before the visit. And most of our patients can respond fairly decently to Cilio. So, oh my goodness, that went super quick.
Don't panic.
It does. The Bridge Club goes so fast. We're into these.
God, it was ridiculous.
The good news is there's an after party, as Catherine mentioned for some of you. You know, hey, we're all about having fun here. So there is an after party. So what we're going to do is those of you who have to jump off, we promise 25 minutes. If you've got to leave, if you've got the kids waiting for you to give them a bath, or, you know, dinner is cooking in the oven right now, feel free to leave. Just drop off quietly. We are going to ask Dr. Pike to give just a couple last words before you guys do. And then anybody who wants to stay on, we can continue the discussion for another 10, 15, 20 minutes and continue to answer your questions. So, Amy, parting thoughts before the people have to hop off?
I guess parting thoughts is don't think that you should only carry one of these products in your practice. You should have multiple things in your toolbox in order to help these patients, because not everybody is going to respond to one thing versus the other. I think it was Laura posted the question of, or posted the story of one of her patients responded well to Cilio, one did not. And I find that with everything in behavior, is that some do and some don't. And you just have to kind of experiment a little bit, do a little bit of experimentation and see what works for everybody. So to help them feel better.
Okay, so we can drop off. Go ahead. Otherwise, we're going to carry on. And we have a lot of questions coming in too. So
Do you want to just do that? Well,
yes, let's jump into the questions.
Oh, yeah, absolutely. So, golly, where do we begin? So we had a couple people ask for thoughts on trazodone.
Yeah. So trazodone, I like trazodone as a situational medication. Works great in dogs. And for like vet visits, I recommend preloading the night before and then giving a dose the morning of at least 90 minutes before the actual appointment. My doses tend to be fairly high, 5 to 10 mg per kg, and I've pushed it a little bit beyond that even. I worked with a neurologist that went up to about 15 mg per kg in some of her epileptic patients, just for behavioral calming when they were in the hospital.
Okay.
Oh, and I saw the gabapentin for cats. Yes, I love gabapentin for cats. It's awesome. And so the nice thing about the gabapentin capsules is that most cats can't taste the powder when you break it open and then sprinkle it in a little bit of canned cat food. Some cats can, so you might have to use the liquid or like hide the powder in a pill pocket or something. But most cats, you can just sprinkle it in a little bit of tuna, canned food, whatever, and they'll gobble it right up. But I absolutely love gabapentin for kitties.
So there was a question on the injectable Dexmed transmucosally. She goes, is there any studies on that?
There is one study using the ditomidine gel, the equine ditomidine gel, and a lot of the behaviorists do use this anecdotally. We will squirt the dexmedetomidine, the Domitor, orally, and it does seem to work, although I think it is a little bit more hit or miss in terms of efficacy, at least in my patient load it has been. But I would definitely keep that in my back pocket for like those dogs that are lunging and aggressive and I just need to get near them. I might actually squirt that in their mouth from afar.
So Marty, you have a question. Why don't you jump in and so you don't just hear Brenda and I talking?
Exactly.
Wait, are you unmuted? Here, let me unmute you. There you go.
You're good.
Oh, can't hear you.
No, okay. I wonder why. All
Okay,
right.
we'll ask it. Go ahead, Brenda.
I'll ask the question for you, Marty. No, we get it. So, okay, Martina Greer, Dr. Greer says that I attended the 4-day NAVC seminar on behavior. There was not a great amount of support by the speakers for Feel Away or Adaptil. They said there was not enough science to support their use. So can you comment on your impression of the research on those two products?
Yeah, there's been a lot of research over the years about the Feel Away and Adaptil products. Unfortunately, most done by the companies themselves. I will say that anecdotally, they work in about 50% of patients. And so it's always worth a try. I always tell people to at least do 2 months of the pheromone products. And then if they don't notice anything, then stop it. And a lot of times they don't notice the changes until they actually stop the product. And they're like, oh gosh, that actually was working. And so, you know, no harm, no foul. You can just start it back up again. But it's about 50%, I would say. So, and then I saw the question about the Feel a Scratch. The research looks really good. I will be honest, and I will say I have not used it. I think it's more primed for general practitioners because I don't see inappropriately scratching cats. You guys see them? So that remains to be seen, I guess, is the answer.
Okay.
Any other questions?
See, I saw a couple of, let's see.
That were further up, I thought that we. So
Exactly.
there was the idea of the brand on the CBD oil. Is there a brand you recommend?
Yeah, I've been recommending the Elevet product, and the reason being is they're the ones that have been doing the studies with Cornell on pain control. And so I at least know that they do quality control on their product and at least determine levels, and they verify that the CBD is actually the milligrams that are in there. So that's the one I've been using. But I have a lot of patients that, I mean, they go down to the local hemp store and like get the dog. You know?
So one of the questions that came in that's not on our feed here is, you know, when should they refer to a specialist? Because a lot of them are GPs. So when do we refer to a specialist?
I think that really depends on their comfort level. I mean, when I was in general practice, I hated surgery. If it wasn't a spay, a neuter, or a laceration, I wasn't doing it. I was referring it. But some people are super comfortable with behavior. And so I'm always happy to talk practitioners through, and I know all my colleagues are as well. And so if you're interested in it, we will help you with cases. If you don't want to touch it with a 10-foot pole, send it. Most of the issues that you see in general practice are not training problems, unless it's like the dog is jumping up or, you know, dashes out the door or something like that, like nuisance behaviors. Otherwise, it probably needs to see somebody that is more skilled in behavioral medicine, like a veterinary behaviorist. So, and I actually have the 2 websites you can go to. So that our college is the dacbb.org, and you can find a board certified veterinary behaviorist. And we're hoping to, hopefully soon, fingers crossed, list the residents on there too. Hi, Lynn. I told you I'd call you out. There are 38 residents now in behavior, which is crazy. It's awesome, crazy awesome. And so we're hoping to be able to list the residents there too, because if you have a behaviorist near you, you at least have probably a resident. And then AVSAB is the American Veterinary Society for Animal Behavior, which is practitioners that are interested in behavior medicine. They may not be boarded, but you can at least find somebody that is interested for in taking cases in your area.
I love that everybody is making such great comments. I mean, comments about success with Feel Away for cats, success using a couple of other products here, and I can't scroll fast enough, gabapentin and trazodone. So love, love, love that you guys are engaging in the conversation. Really want to say thank you for that too. This is working exactly the way it's supposed to. Thank you.
You have 2 very happy women here. That's the important. Oh, but we've got Wolf Song. I love the name. Also has a question. Go ahead.
It automatically logged me in as my email, so I didn't.
Oh, nice.
My actual name's Noelle. Hi.
Hi, Noelle.
So just on the efficacy of the Adaptil, I have 5 rescue basket case dogs downstairs who you've heard a peep from. I have 1 plug-in, and then I sprayed the spray all around their beds before we started. So I think that speaks for the success of the Adaptil.
Yeah. I mean, they can be pretty successful. Yeah. I think a lot of people's issue with their research is that it is sponsored and done by the makers, which is legitimate. I mean, that's a concern, certainly, but I think anecdotally in my clinical practice, I use them all the time.
So question, another question that came in a little bit earlier through a private chat, Amy, was, you've talked about a lot of different particular products. I mean, how many products do you think a general practice should have on hand? And you were commented earlier that some respond to different products than others do. So how many should you have? How many you try?
Well, again, I think it depends on your comfort level of treating behavior cases. But at a minimum, I would have all the FDA approved products. So the medications like Clomicalm, Reconcile, Cilio. And then if you wanted to have the pheromones and the 2 supplements that I talked about, I think that's a really good pharmacy cabinet basically for behavior. And so now keep in mind that the supplements and pheromones can oftentimes be more expensive than the medications, which I find very frustrating, that they can go to, Walgreens and get generic fluoxetine for $4 and, pheromone collars like 26 for a month's supply. So, it's definitely dependent on what you guys want to, how much you want to delve into behavior. But I think that the products that I went over is a good starting point.
Good. And then how long would you say, just a quick follow-up to the back end of the question, how long should someone try a product before determining if it really is working or not? Because of course we all want instant satisfaction these days.
Yeah, absolutely. So none of these products would I just give one and done. And so I would start at low doses and work my way up if there's a dose range. For our dailies, like our Clomicalm and our Reconcile, you're gonna need to give it that 4 to 6 weeks and then increase your dosage accordingly before you can say that it's just not working. Our situationals, 2 to 3 doses, and I would probably, depending on the situational, I may have to say it's just not working for that patient. So it is a little bit of experimentation and rolling of the dice to try and figure out what works for each individual.
It's important, I guess, then for everyone to make sure that the pet owners understand it's a little trial and error, and it may take a moment to find out what really works, and don't get too frustrated too quickly.
Yeah, and it's not overnight success.
Anyway.
So I will say everyone's being really good with their mute button. So we've got about just a few more minutes. If there's that last minute question you're wanting to ask, now's the time to just kind of jump on in. We are, under normal circumstances, we are a mute-free zone, but because we've had a larger group tonight, we did want to make sure that we were careful. But now's the time. So you have access to Dr. Amy Pike. So any questions, you can still put them in the chat.
And yes, and apologies if Catherine and I have missed anything. We've been trying to scroll through, and Amy's done a great job as well. So if we've overlooked a question, pop it in there again, because it's hard to keep up sometimes.
Or just shout it out.
Just shout it. Exactly. All the better. Just shout it out, right?
We have to unmute. It's in the upper right-hand corner.
Yeah.
What do I think of Rescue Remedy?
Oh, Melissa. Go for it, Melissa.
Go, Melissa. I'll answer the Rescue Remedy one.
The Soliquin, I'm currently using the Soliquin on my dog, and it worked really well, and I was recommending it to the clients.
Mm-hmm.
As far as the Angstane goes, does it take quite as long to get into the system as Soliquin? Like it was like 30 to 45 days to actually see your premium results.
No, I've seen much faster results with the Angstane. In fact, in one doses, like in one dose for some patients. In Pongo, that was 2 weeks, and that was significant. And so with my thunderstorm study, we saw effect at about the 3-week mark, and then they were much more effective if they went the full 8 weeks during the storm season. So I still always say, like, let's keep using it, but I would say it's probably quicker than Soliquin.
Okay, thank you.
You're welcome.
So back to the Rescue Remedy question.
Yeah.
What do you think about that?
I'm not a big fan because Rescue Remedy is homeopathy. And so if you're familiar with, the concept of homeopathy, it's basically taking something that would cause disease and breaking it down into such small, parts per million, and then giving it to the animal. There's probably 80,000 literally studies in human medicine on homeopathy, and not one of them has shown efficacy. So I'm just not a big fan. And most of my patients have already tried that before they come to me. And
so as a pet owner, I want us to answer Amy's question because I have the Thunder shirt.
We've had a couple of people asking about the Thunder shirt, so I think that's a good one to bring forward.
Yeah. So the Thunder shirt works in about 60% of patients. The concept is like swaddling a baby. Like if they feel comforted by that pressure, it's going to help. The cool thing about Thunder shirt is if you buy it through the company, They offer a money back guarantee. And so I always tell my patient or my clients it's worthwhile trying it. And if it doesn't work, you send it back, they refund your money, and then they take those and donate those to shelters.
I love that.
Kind of a win-win. Yeah.
That's really a good one. We've had a couple questions too about, hold on. Do you find that any of these anti-anxiety products actually work for aggression as well?
Yeah, so I do. Now, all of them are pretty much going to say on the label not to use for aggression. And, you know, I think that that's a disclaimer from the pharmaceutical companies, right? But aggression stems from fear and anxiety. And so if we're decreasing fear and anxiety, therefore we're going to hopefully decrease the need to use that behavioral strategy. So, I mean, 99% of my patient population is aggression, and these are all the products that I use. And so, yes, definitely.
Great question. Yeah, that's a good question then too. We had a question too on gabapentin for anxious dogs.
Yeah, I don't find it as good of a solo agent as it is in cats, but it can be a good adjunct. My favorite combo is fluoxetine and gabapentin, but not as a solo agent in my experience. Lynn, what about you? Because I know your mentor is a huge gabapentin fan.
Yeah, I actually love that combination as well. So I use a lot of fluoxetine and gabapentin. Very rarely do I use gabapentin by itself.
Mm-hmm.
But very often in combination. I like it a lot.
Yep.
So, and we covered a lot, but I want to make sure, you know, did we, can you give a summary again on the cyclic, like, I'm going to send it. Yeah, can you do a quick summary? Because we ended up having someone miss part of that conversation. So just quickly do a recap on that.
On the, what was it, the Zilkine?
That's it.
All right. Yeah, so Zilkine is alpha-casozepine, which is a protein in cow's milk, and it binds to the benzoreceptors in the brain. So it's really good for panic disorders, for anxiety disorders, storms, vet visits, all that kind of stuff.
Okay, then the other question was thoughts on Stress Away by Vet Classics.
I saw that question come through. I'll be honest, I don't know that product at all, so I can't comment to it.
All right, fair enough. Right,
that works.
Okay,
that works.
Okay, so another one here. My personal dog is fearful in dog shows. Oh well, they tried it, right? And Trazodone didn't touch him. He was a rock star on gabapentin, so that's pretty good. I mean, that's good. That's good to share, right?
Yeah,
absolutely.
So we are coming to the close on this because we do promise you by the end of the session. I'm sure for many of you this was a brand new experience. I hope you will come back for more. The purpose of our conversations are so we can actually engage. We know we go to different conferences, we see someone like Amy up on the stage, and we don't get the opportunity to engage with her. So that's our purpose of bringing people together and to network with one another and see folks that you might really enjoy. So I really do appreciate both Virbac for bringing us Dr. Amy Pike. I had not met her prior to that relationship. She's fantastic. So
well,
before she does a parting shot, I do think we have to say cheers. If you could raise your glasses for one last moment to toast Amy on her great job tonight. So cheers on to that.
Way to go, Amy.
And by the way, you always have to drink.
Yes, you have to drink.
You can never not cheers if you haven't. Check out
I
our
only have
website.
orange
We've got
juice
more
left.
conversations coming. We've got more conversations, as we talked about, with cannabis overall. We're going to be talking about the medical use. We're going to talk about in practices. We are going to be having a huge tech week in October. All the conversations are going to be focused on technicians. We're going to be doing the same thing for practice managers. So really excited about what's coming up. And if you have something you want us to talk about, send Brenda or I a message. We're all about bringing the conversations forward. We always say there's nothing we can't solve over a glass of wine. And we mean that seriously. So with that.
Well, one thing I think it's really important to say that membership in the Bridge Club is free. So if you want to become a member, get on our mailing list and have updates on what is coming down the pike and be able to register for it, go to our website, www.thebridgeclub.com, and register. All access membership is the level of membership that is paid. It's a one-year annual fee that gives you access to every single video we do. So if you miss a session or anything you've missed up to then, you can join and do that too. So I say that, and I'm sorry, Catherine, because I know we were wrapping up, but a couple people had chatted and asked, how they.
Yeah, it's free. This is free. And we want that because we figure we can't move forward if we're not having a conversation. So you can refer people. Doesn't cost you a cent to be able to come. It's just you can't get the videos. So the notion being, but tonight you will, because this is brought to you by Virbac. So we are very grateful that they're doing that and supporting the Bridge Club and everything that we are trying to accomplish. So with that, though.
Exactly. Amy, do you have anything you want to wrap up with before we say goodbye?
No, just know that, as specialists, we're all very approachable. And if you ever have questions about cases, medications, anything like that, please don't hesitate to contact us. That's one of the reasons I wanted to do my residency, is educating other veterinarians. So that's what we're here for.
Fantastic. Well, everyone, have a great evening and cheers for coming to your first Bridge Club. Thank you so much.